Okay, let's dive into this. Welcome to our explainer on men's health and healthy aging. Today, we're taking a really focused, proactive look at what it means to maintain your optimal health, especially after crossing that big age 40 milestone. This isn't about fear or dwelling on what can go wrong. Instead, we're giving you an evidence-informed guide to taking charge of your daily wellness. We'll be understanding the unique medical realities of the male body and, frankly, feeling empowered by modern medicine.
To do that, we've structured this explainer as your proactive playbook. Here's our agenda for today. 1. Habits for healthy aging. 2. Understanding the prostate. 3. Recognizing the risks. 4. Screening and diagnosis. And 5. Navigating treatment options. Let's get right into it.
Section 1. Habits for healthy aging. So, it's vital to remember that men over 40 have an immense amount of power to support their overall wellness through proactive, everyday choices. Seriously, your health isn't just something that happens to you, right? It's something you actively build. Think about healthy aging. Guys out walking, lifting weights, drinking plenty of water, and actually getting a full, restful night's sleep. These aren't just feel-good concepts. They are literally the pillars of longevity. Proper nutrition, consistent hydration, quality sleep, regular exercise, active stress management, and staying on top of your preventative checkups, all of this forms a robust shield that supports everything from your heart health down to cellular repair.
And when it comes to that first pillar, nutrition, certain natural foods are veritable powerhouses specifically for prostate health. Picture preparing a vibrant meal loaded with fresh berries, maybe some cooked tomatoes, pumpkin seeds, wild-caught salmon, and finishing the whole thing off with a nice cup of green tea. These foods are just packed with nutrients, antioxidants, and healthy fats that directly support a healthy aging process and keep your body thriving.
Section 2. Understanding the prostate. Let's move to this next part and see how it builds on what we just discussed.
All those great nutritional habits we just talked about, well, they directly impact this highly important gland. So what exactly is the prostate? Basically, it's a small, walnut-shaped gland located just below the male bladder and in front of the rectum. Its primary biological job is to secrete a fluid that mixes with semen, which is what keeps sperm healthy. It's a tiny organ, for sure, but it plays a massive role in men's health.
Section 3. Recognizing the risks.
Now we're going to shift calmly into some clinical realities. Our goal here is pure education and awareness, absolutely free of fear-mongering. Knowledge is your best defense, right? Take a look at this number, 13. For every 100 males, 13 will develop prostate cancer at some point in their lives. It's a common reality, yes? But as you'll see shortly, it's also highly treatable when it's caught early.
So who exactly is most at risk? Well, the primary risk factor is age. Your risk increases significantly once you pass 50. In fact, about 60% of cases occur in men older than 65. Race and ethnicity play a role too, with a higher risk found in men of Black or African ancestry. Family history is also absolutely critical. If a close male relative had it, you are 2 to 3 times more likely to get it. Finally, specific genetics, like BRCA mutations or Lynch syndrome, can also elevate your risk.
But here's a fact that highlights exactly why we need to be proactive. Early-stage prostate cancer rarely causes symptoms. As a tumor progresses, a guy might experience an urgent need to pee, weak urine flow, or even pain in the lower back or hips. But in the beginning, often, there is literally nothing at all to signal a problem. That lack of early symptoms is precisely why proactive screening is a non-negotiable.
Section 4. Screening and diagnosis. Now, if you're feeling a little nervous about this process, be reassured. Doctors have a very clear, structured, and logical pathway for evaluating prostate health. Let's walk through that logical progression step by step. It typically starts around age 55, or earlier if you have higher risk factors like we just mentioned. Step 1 is screening, usually involving a simple PSA blood test, which checks for a specific protein made by the prostate, alongside a digital rectal exam. If those show something unusual, doctors move to Step 2, imaging. They'll use an advanced MRI or ultrasound to get a clear visual. Finally, if needed, Step 3 is a biopsy, where a small tissue sample is taken to definitively confirm a diagnosis.
If a screening does catch something, what happens next? Well, doctors rely on 2 distinct metrics to determine severity, and this brilliantly illustrates how they approach it. First, the Gleason score focuses on the microscopic level. It rates how abnormal the cancer cells are, which tells doctors how aggressive the tumor might be. On the other hand, cancer staging determines macro-level severity. This means seeing how far the cancer has actually spread in the body, whether it's localized, regional, or metastasized.
Section 5. Navigating treatment options.
Once those metrics are clear, a specialist medical team steps in. This is where you work with specialists like urologists and oncologists to explore a truly wide and advanced array of modern medical therapies. Because prostate cancer often grows very slowly, immediate treatment isn't always the first step. Actually, two common non-invasive monitoring strategies are active surveillance and watchful waiting. Active surveillance involves regular screening and scans to track a low-risk cancer closely, stepping in only if it starts to grow. Watchful waiting, however, is typically used for older patients with other health issues, where the focus shifts away from intense testing and instead focuses simply on easing any symptoms.
Now, when active intervention is needed for cancer that is confined to the prostate, localized treatments are incredibly advanced today. A radical prostatectomy, which removes the gland entirely, can now often be done using highly precise robotic surgery. Radiation therapy offers options like targeted external beams or brachytherapy, which is where tiny radioactive seeds are placed directly inside the prostate. There's also newer, minimally invasive focal therapy. This uses things like high-intensity focused ultrasound or cold gases to freeze and destroy the cancer cells. It's truly amazing technology.
But what if the cancer has spread beyond the prostate? Now, what's really interesting about this slide is seeing how vast the modern systemic therapy arsenal is. Hormone therapy is used to block the testosterone that helps the cancer grow. Chemotherapy uses robust drugs to wipe out cancer cells. Immunotherapy actually boosts the patient's own immune system to find and fight the disease. And targeted therapy hones in directly on the specific genetic mutations of the tumor itself.
Of course, we need to be honest about the realities of treatment. Procedures can come with potential side effects, primarily incontinence, erectile dysfunction, and infertility. But here's the optimistic takeaway. Managing these side effects is a core part of modern care. Things like incontinence often resolve naturally within 6 to 12 months. For erectile dysfunction, modern medications and therapies are highly effective at restoring function. And if preserving fertility is a goal for you, sperm banking prior to treatment is a completely standard, easy option.
The absolute key to successfully navigating all of this is being a strong advocate for your own health. You might be wondering, okay, so what should I actually ask my healthcare provider? Empower yourself with direct questions. Ask your doctor about the exact stage of the cancer, what the specific treatment side effects will look like for you personally, whether your family is at genetic risk, and exactly what your follow-up care plan entails. Don't be afraid to ask.
So the crucial point is this. When prostate cancer is found early and remains localized, the 5-year survival rate is an incredibly encouraging 99%. Let me say that again, 99%. That is the true power of being proactive, knowing your risks, getting screened on time, and leveraging modern medicine.
And that wraps up our explainer. Always remember, healthy habits today can make a big difference tomorrow. Always consult a qualified healthcare professional for personalized medical advice. So as you go about your day, I want you to ask yourself, what is one healthy habit you can upgrade today to protect your body for tomorrow? Stay active, stay informed, and take charge of your health. Thanks for joining us.